from today. My name is Dr. Zainab Abdullah, View Community Engagement Officer for Pharmalad, and having you all here discussing this important topic today, titled Utilization of High-Tech Equipment in Diagnosis of Animal Diseases, showcasing Dual Energy X-ray Absorptiometry, which is the DEXA, Multi-Parameters Veterinary Patient Monitor and Endoscopy. This topic really helped us to learn how an improved tool can help take our practice to the next level, as well as ease us from difficulties in trying to do diagnosis of osteoporosis, predict and diagnose fracture, monitor therapeutic progression to test and measure body compositions such as body fat, muscles, mass, and also in evaluating carcass quality during meat inspection, and lots more. And that is why today we are having brain box behind this beautiful topic today as our hub experts. So please permit me to recognize the presence of Professor Paul Boko, as well as Dr. Aliyu Haruna. You're welcome, sir. And also in our midst today is the current Dean, Faculty of Veterinary Medicine, University of Maiduguri, in person of Professor Yakubu Gaidam. You're welcome, sir. So shortly, I will be taking us through the agenda by sharing my screen, so you have an idea on what the programs looks like. But before then, I would like to welcome each and every one of us to yet another tech class session by Pharmalad, who is in partnership with MDoc, Moringa Ingilham, Ashoka, Making More Health, Veterinary Council of Nigeria, and Project ECHO. This secular project leverages 4 ECHO pillars, where we video conference technology to leverage on scarce healthcare resources, especially sharing based practice with colleagues, case-based learning, and continuous monitoring of program outcome. So please take note that Project Tekla Africa leverages ECHO model, where we collect registration, participations, questions and answers, as well as chat comments and poll response for all our programs. Your individual data will be kept confidential and will be handled by an authorized personnel. This data may be used for reports, maps, communication, survey, quality assurance, evaluation, research, and to inform new initiatives. This session is being recorded and we'll be sharing PDF of the slide after the session. So here are some few participation tips that you need to know, please. You can have your camera on. The facilitator will unmute you when there is need for you to speak. Please use the raise hand feature in Zoom when you want to speak, and kindly use the chat function for any questions respectively. So like I said earlier, Pharmalad partners with Ashoka, MDoc, Moringa Ingilham, Making More Health, Veterinary Council of Nigeria, and Project ECHO. So now on the agenda is brief about Pharmalad, which will be said by Dr. Elizabeth Uju. So please, Dr. Elizabeth, over to you now.
Okay.
Dr. Elizabeth.
Yes, I'm here. Good morning. Good morning, everyone. Just as introduced, my name is Dr. Elizabeth Ene Ojo, and I serve as the Partnership and Growth Manager for Pharmalad Abuja. Pharmalad is an essential health social enterprise founded in 2019 with the primary mission of enabling easy access to affordable animal health care in underdeserved community in Africa. Animal diseases are the leading cause of losses to livestock, farmers, and pet owners, accounting for over 70% of the total damage. Unfortunately, the animal health system in Africa leaves little to be desired and goes a long way to adversely affect these farmers, pet owners, who are the lifeline of our local food system. At Pharmalad, we have been able to combine our relevance as a major animal health care brand in the marketplace with our mission of ensuring the easy availability, accessibility, and affordability of these animal health products and services across the country. So we partner with local animal health professionals, mainly veterinarians, who partner with these local farmers to pet owners in building an inclusive system for sustainable animal health and disease prevention. We also foster a peer-to-peer network where access to regular animal health products, veterinary services, and pieces of training can be easily obtained, and learning at various levels of farmers' interactions shared. Summarily, we are enabling easy access to quality animal health across Nigeria and soon across Africa. Our TECLA sessions are a partnership between the largest privately held animal health company in the world, Boehringer Ingelheim and Ashoka, an organization designed to support social entrepreneurs using the Making More Health platform. With the help of MDoc, our execution partner, our TECLA section moves knowledge rather than people by utilizing digital technology like video conferencing application we are currently using. It is our utmost desire that you will find this section both useful and inspiring in your various choosing areas of specialty. Once again, I warmly welcome you to our ever-growing animal health community, where we derive absolute pleasure in helping you to win. Please enjoy the section. Thank you.
So thank you, Dr. Elizabeth, for sharing this with us. So next on the agenda is the goodwill message from the Able Dean, Faculty of Veterinary Medicine, University of Maiduguri, in person of Professor Yakubu Gaidam. So, sir, over to you. Yeah, highly welcome.
Okay, thank you all, and welcome to this edition of the TECLA program. It is with great pleasure and enthusiasm that I extend a warm welcome to all for the May edition of the Teleeducation and clinicians for clinicians and leaders in Africa, the TECLA program, organized by Farm Alert in collaboration with the Faculty of Veterinary Medicine, University of Maiduguri. This program actually stands as a beacon of innovation and collaboration poised to elevate the standards of veterinary medicine across Africa. We must commend Farm Alert for their outstanding and innovative initiative like this and others such as the Inspire program, the Outlier Award, and many others that sufficiently contribute to the advancement of veterinary profession in Nigeria. For example, the author of this program, Dr. Zainab Abu, is proudly the winner of our last year's Outlier Award and from our faculty. And recently for this year, we have Dr. Ibrahim Gangu, who we are all proud of. The faculty is particularly excited to showcase some of the cutting-edge technologies we use that enhances our clinical practices. These state-of-the-art tools represent the forefront of veterinary diagnostics, enabling precise and efficient assessment of animal health conditions. It is also important for us to say that the selection of some of our finest experts that work with this equipment to represent or to make a presentation to reflect on our commitment to excellence in education and professionalism and professional development of veterinary medicine. The expertise and insights which undoubtedly enrich your understanding and proficiency in the utilizations of this high-tech equipment. Once again, I extend my heartfelt welcome to each and every one of you may this program be a source of inspiration and enlightenment and empowerment as we work towards a future where every animal receives the best possible care. Thank you very much.
Thank you so much, sir, for this wonderful goodwill message. So next on the agenda is the pre-quiz session, where we have 5 minutes. Actually, the essence of this pre-quiz is to test your knowledge and idea on what we are discussing today. So please, I would like us all to participate, as it's not going to be a very difficult one. So please, let's engage. Let's keep engaging. Let's try and attempt the questions that it's 5 minutes. Okay. Hope we all are participating. Please, let's keep engaging. Let's keep engaging. Please, let's try and participate. It's very important, at least to test our knowledge and idea on what we are going to discuss today is all about. Please, more people. Let's participate. Four more minutes to go. Please, let's keep on engaging. We have only 5 minutes and 1 minute 30 seconds is already left. Please, let's keep participating. Let's participate. It's not the very difficult one.
Dr. Zainab, this is very difficult. It's jam question. So just to let people know, you don't need to. So even if you don't know, just guess. But the purpose of the program is that at the end of the day, we have Professor Paul who will take
Yes,
us.
he's going to sort it out.
He will sort out everything. This is one of the most difficult pre-quiz I've seen in recent time. So I myself don't know all the answers, but I've participated. I wish myself good luck.
Okay, good luck.
I wish you good luck.
You can also comment done if you're done, so that at least we know that you have submitted your opinions. The essence is also to find out at the end of the day that you have also learned the correct answer to the pre-quiz. Thank you.
Exactly.
Over to you, Zena.
Okay, sir, thank you. 2 more minutes to go. Let's keep on answering it. Perhaps I know everybody is vet, so I know it's not going to be that hard.
What it requires is not only a vet.
But we have our professors here with us today to sort this out for us. So please, let's keep engaging. Okay. 1 minute, 20 seconds to go. Please, let's keep participating. I hope this does not scare you out. Okay, 1 more minute to go. Let's keep engaging. Few more seconds. Okay. 30 more seconds to go. Please, let's keep participating. We just have like 20 seconds to go. Seven more minutes, 5 more seconds. Wow, it's time. So, okay. So thank you all for participating in this pre-quiz session. And I've seen a lot of people have really tried and participated very well. So next on the agenda, permit me to welcome our hub expert in person of Professor Paul Boko from the Department of Veterinary Surgery and Reproduction, a professor of molecular orthopedics and large animal veterinary surgery from University of Maiduguri. Professor Paul Boko had a lot of positions, starting from Secretary General in Boko Community Development Association, a financial secretary of Nigerian Veterinary Medical Association, Borno State chapter, editor of Animal Veterinary and Animal Science Nature publication, Academics, Dhaka in Bangladesh, a deputy editor-in-chief for the Sahel Journal of Veterinary Science from Faculty of Veterinary Medicine, University of Maiduguri. He also served as the first HOD, Head of Department of Veterinary Surgery and Radiology, UNIMED, and the first ever Deputy Director of Veterinary Teaching Hospital, and also the Director of Veterinary Teaching Hospital, University of Maiduguri. He has over 50 research articles in high-impact peer-reviewed international and local journal. Professor Paul Boko discovered chondroclast remodel soft callus into hard callus, thereby regulating the pace of fracture healing, which leads to the currently accepted model of specific, the non-specific anabolism, catabolism concept fracture repair. He also discovered constitutive activation of AMPK cascade triggering mitochondrial cytopathy, which was published as the discovery of the year 2006 in Latrobe Bulletin. Green Nobel, France, and was awarded the Australian New Zealand Academy of Science Award for the AMPK work, which was commemorated with a discovery ring in 2008, where he won a total of 3 meticulous Australian scholarship. Not only that, he also won the Dean's Prize as the best student during his undergraduate. Professor Paul Boko has a lot of citations to mention, but permit me to welcome Professor Paul Boko to give his presentation on this particular topic. So you're highly welcome, sir. You have 25 minutes, as we're indeed grateful having you here to discuss this important topic with us today. So thank you, sir.
Okay, thank you. Thank you so much, Dr. Zainab. I would like to, without taking too much time, just stand on the established and the existing protocols so that I can just start the presentation. And so, without wasting too much time, the topic of the presentation today is utilization of high-tech equipment in diagnosis of animal diseases. And we are showcasing the multi-parameter veterinary patient monitor, endoscopy, laparoscopy, and the dual energy X-ray absorptiometry for the today is all going to be about diagnosis and probably en route to treatment. So the basics would mean that diagnosis is a basic process of identifying a disease, the condition, or injury from its signs and symptoms, or the absence thereof. So diagnosis is a very key pillar of veterinary clinical practice, and the accuracy of diagnosis is essential and cannot be overemphasized. Now, making diagnosis is built on health history, physical examination, laboratory and blood tests, imaging tests such as MRI, CT scan, ultrasonography, endoscopy, in the person of endoscopy, laparoscopy, arthroscopy, biopsies, and so on and so forth. So all these things are done so that
No, go on, go on, go on, go on, go on. Whatever it says. Yeah, just hold on, just hold on.
Okay, sir, you can go on.
okay, can you hear me?
Yes, sir. Yes, sir.
All right. So
Okay, sir, we are sharing the screen.
okay.
Yeah.
I think we're on different screens. So
Yeah.
should I log off my own?
Yes, yes. We'll be sharing the screen.
Okay, let's share for me then. Since I cannot make the screen smooth or anything.
Okay, so we have shared the screen. You can
Okay.
go on.
All right. No, it's still on slide 1. It doesn't move to the next slide at all.
Okay, sir, can you hear me, sir? We are sharing from our end. So once you want us to go to the next slide, just say next, and then we'll go to the next slide. Thank you.
Okay, all right. So, yeah, so maybe start from the second slide, because this is the third slide. Yeah, so like I was saying, diagnosis is a process of identifying a disease, a condition, or injury from its signs and symptoms.
Sorry, please, your video is off, sir. Sorry. Your video.
Okay. Diagnosis per se is a key pillar of veterinary clinical practice, and the accuracy of this is essential and cannot be overemphasized. So making diagnosis is built on, as we were taught in the introductory medicine course, it starts from history, whether the health history or disease history, physical examination in the hospital or the clinic, and then laboratory and blood tests performed to determine certain parameters, imaging tests such as MRI or CT scan, endoscopy, laparoscopy, and you also can obtain biopsies next. And so, next please. So diagnostic tools are the devices you can use to come to reach a diagnosis. And the purpose is to enable clinicians gather precise information to aid in early detection of ailments and then monitoring of disease patterns. So getting the diagnosis right is key, and it provides explanation of the patient's health problem, and it also informs subsequent healthcare decisions. So a diagnosis is vital in the sense that it optimizes the best course of action, and it allows the creation and implementation of evidence-based treatment plans. Next slide, please. So where diagnosis is accurate and made in a timely manner, a patient has the best opportunity for positive health outcomes because clinical decisions will be tailored to a correct understanding of the patient's health problems. And then treatment can also come easy and complete. Conversely, however, a diagnosis error may result in the patient being denied timely and effective therapy. It could also cause administration of potentially toxic and incorrect medication, and the consequences of this can be devastating a lot of times. Next slide, please. So to that effect, there is a drive, the previous slide. Oops, going forward instead of. There's a slide before this. Okay, no, this is the correct one. Yes, next slide, please. So there is a drive to make diagnostic tools more efficient and effective. When this is achieved, it saves time and it also saves cost. It also allows the observation of the tenets of good veterinary practice. This would be things like welfare issues, pain management, shorter convalescence, effective treatment regimen, as well as lofty management etiquette, among other things. So very many diagnostic tools has been developed and continue to be improved. So it can range from an analog tool to a diagnostic tool, to the digital tool. It can be a transition from a manual to an automatic diagnostic. A simple example would be a mercury thermometer. 20, 30 years ago, you would have a mercury thermometer that takes about 1 to 2 minutes before you can get the temperature. Today, we have what we call the infrared clinical thermometers. So you can take the core body temperature in just 10 seconds. The same thing applies in case of radiography. In the past, we used to have this radiograph on the film that the patients or the doctors carry around, but today we have electronically captured real-time images and stored in a digital format. The advantage of that will be, one, it can be stored. Two, it can be edited, it can be analyzed, and it can be sent to other specialists so that you can get the second opinion. At the Faculty of Veterinary Medicine, University of Maiduguri, we have acquired and trained relevant staff on the utilization of high-tech diagnostic tools to enhance the accuracy of diagnosis en route to effective treatment. Currently, we are also awaiting the delivery of a laparoscopy system through an equipment grant, not through the usual bureaucratic system of government. So I can confidently say today that we will get it sooner. For the purpose of this presentation, we're just going to look at those listed diagnostic tools briefly each, and we're only going to look at the function and applications. We're not going to technical and principles of operation because of time crunch. And so we have a veterinary multi-parameter patient monitor at the VTH. So we're going to talk briefly about that and other aspects. We have endoscope, so an endoscopy system as well. We are awaiting the delivery of laparoscope, and we also have a dual energy X-ray absorptiometry, popularly acronymed DEXA. This was acquired through a TED Fund research grant given to our research group, so it enables us to obtain that. So collectively, these tools, along other high-tech diagnostic tools, including imaging tests, laboratory protocols, can be a boon to veterinary practice in Nigeria. Next slide, please. So this is a typical example of a patient monitor, which is ready for use. So the terminals or the accessories are connected on the one on the left. So just the terminals now is to be connected to the patient, and the one on the right has all the accessories in place. So this is an example of what the patient monitor is. There are many types, but we'll just make do with this one. Next. But before the advent of patient monitors, practitioners developed clinical profile of patients via the consecutive measurement of the core body temperature, either in degrees centigrade or Fahrenheit, the pulse or the heart rate, the respiratory rates, mucous membrane color, capillary refill time for capillary network function or tissue perfusion, skin rebound time for hydration status, blood parameters, PCV, among other things. These are vital parameters in their own rights to guide on the condition and the impact of illness on the patient. However, they are subject to individual honest opinion errors that can be cumbersome. They have limited spread, they are time consuming. You can't also record them on a continual basis, and you have to do them one at a time. So they are usually, they are important, but an improvement about them has come in the form of patient monitors. Next slide, please. So the patient monitors does the same thing, but it does it in a continuous process. So it continually measures the vital parameters during diagnosis and at all treatment stages until you don't want to monitor again. So it monitors patients' vital signs and warning systems so that if something goes wrong, the monitor can alert the person in charge or the doctor on duty. It can also record changes in the patient's physiology. It can also verify the pathophysiology or the physiopathological state of the patient. So we find them in many places like the veterinary hospitals, the veterinary clinics, intensive care units, operating rooms, ambulances for paramedics to work on, and so on and so forth. So there are basically four types. You have the central monitoring system, which is a complete secluded area dedicated to a particular group of patients. So the one or two persons can monitor the condition of a lot of patients at the same time. So the monitors are not in the same place from the patients. So we call them central monitoring system because they are remote from the patients. So it's called, and then we have the fixed monitors. So this is where the monitors does not move and is usually for one patient at a time. And as you can see, this guy lying down here probably is anesthetized. And so the vital parameters are monitored on this patient. So the patient and the monitoring gadgets are all in the same room. Next. Then we can have a bedside monitor. So this is how it looks like. A patient connected to that, even if it is an admission, it will have its own monitor on its bedside in its corner. Next. Then we have the portable ones. So this is probably more interesting to practitioners, the field workers, or private practitioners. And the thing you can do with this is you have this gadget that can measure 5 to 7 vital parameters, but it's like a mobile phone. So you can pop your mobile phone in the pocket and pop the the portable patient monitor in your pocket and you go out and practice, and it will tell you the temperature, the heart rate, the pulse, the blood pressure, and so on and so on and so on, about 7 gadgets. I think it's much better and more comfortable than carrying thermometer and other these devices. So the BM5 Vet Elite, we have this at the VTH, University of Maiduguri. And if you look at these parameters, you find out that you can see the blood pressure NIB at the bottom. You can see the temperature there. You can see the ECG, the pulse, the SpO2. So all of these figures, they have meanings. And you can have the patient data too. The name of the patient is Ari, the time and the date, and so on and so forth. So this is a classical basic patient monitor, or this is just basic patient monitor that gives you up to about 7 vital parameters at the same time and in a continuous manner. Next slide. So what does the monitor do? The integrated, the patient monitor it basically measures a group of vital parameters at the same time. So it can measure, it can record, it can distribute, it can display combinations of different biometric values, whether it's physiological or biological. And you can use that to determine the body condition score of the animal. And such parameters would include the heart rate, which is a measure of the body temperature. And then we have what we call the non-invasive blood pressure, although we don't measure blood pressure in animals, but believe me, they have situations where, especially the pets can have high blood pressure. It's called systemic blood pressure, or sometimes the transient one is referred to as white coat blood pressure. Then measure the respiratory rate and the ECG. So you have 1, 2, 3, 4, 5 now. And if you go to the next slide, in continuation of the basic integrated set parameters. So these are the things that are key that we are not usually conversant with, or we don't usually measure them, but they are very easy to come by using a patient monitor. The saturation of peripheral oxygen, or oxygen saturation, shortened as SpO2, is a measurement of oxygen bound to RBCs as a percentage of the maximum it can carry. So ideally, it should not go below 95%. So it should always be between 96 to 100%. And if it goes below 90, then the patient will start having this cardiopulmonary emergencies and maybe eventually an arrest. So it's important. The key importance of this is if you take a PCV, sometimes in a patient, the PCV will look normal, but you don't know the SpO2. And then the condition of the animal keeps deteriorating. And then you wonder why, because the blood is supposed to be quantitatively okay, but probably if you take like carbon monoxide poisoning, for instance, yeah, the PCV will be normal, but the oxygen carrying capacity of the red blood cells had been impeded by the carbon monoxide. So the PCV will be okay, but if you take the SpO2, it will definitely be below 95%. So you know at that time that something is wrong. So although quantitatively the blood looks okay, but qualitatively there's some problem. Secondly, the partial pressure of carbon dioxide, PaCO2, in arteries. The idea is there should be no carbon dioxide in the arteries, but sometimes they do. So it's a measure of the amount of carbon dioxide in the arteries and the efficiency of their removal. So the PaCO2 range should not be, should be between 5.1 to 5.6 kPa. And the ET, end-tidal carbon dioxide, or EtCO2, is the level of carbon dioxide that is released at the end of an exhaled breath. So once the animal exhales the air, the amount of carbon dioxide there will tell you the efficiency with which the ventilation is occurring. So the PaCO2 and the EtCO2 are indicative of respiratory functions, and so they will tell you whether the ventilatory status of the animal is okay or not. And the two together are the fastest indicator if there is any ventilatory compromise. So these vital parameters are determined at the same time, and so they can provide concurrent multiple informations needed to understand the patient's condition, and then it will give an estimation in real time of the prognosis or the situation of the animal. So those ones are the basic parameters, but if you want to go deeper, then there is what we call the extended parameters, and they are listed on the right here. And so if you look at this patient monitor, it is called UM300 series, and it was developed in response to COVID-19. So the beauty of it is you can do so many things with it. One, you can customize the type of parameters you want, so you can select the parameters you want and say, I want this only. So it will just measure those ones, and then it will not measure any. But totally, it can measure up to 15 to 20 different parameters. So in addition to the ones it can measure like the basic, it can also measure what we call impedance cardiography, ICG. So this measures the mechanical function of the heart. We already know what ECG does. It measures the heart rate and the rhythm, and so we call that electrical function. But there is mechanical function too. So the force of the pulsation, the force of the blood going through the resistance of the blood vessels and so on and so forth. So these are the mechanical aspects. So this monitor can measure both the impedance or the ICG and the ECG. In addition, if you want to go deeper and know more about the blood pressure, it can do what we call invasive blood pressure measuring instead of the non-invasive blood pressure. It can also tell you whether the signal transmission up and down, like neuromuscular transmission, occurs or not, or how much of it is working. In addition, it can also do the EEG, so electroencephalography in the form of encephalogram can be measured. It can also measure bispectral index. So this is a monitor of alertness or the level of sedation or the level of anesthesia in the animal. If you anesthetize the animal, it usually goes to sleep, but we don't know the level. But with this kind of parameter, it will tell you at what plane of surgical anesthesia it is, I mean, at which plane of anesthesia it is, and so on and so forth. And it can also be used during anesthetic processes by inhalation. So if you do inhalational anesthesia, it can measure the gases components during the anesthetic process, whether the nitrous oxide or the carbon dioxide or the halogen or the isoflurane and so on and so forth. So this can measure so many, but you can decide what you want. You want the basic, it will give it to you. You want the extended, it will give it to you. You want a customized one that you can decide on by yourself, it will give it to you. But if you want everything, then it can come up with that, and then you can flap through it just like you do the pages. So I think for the patient monitors, we just probably, because of time, look at something else. And so the next slide, please. So in addition to that, we look at endoscopy. So endoscopy is a high-tech procedure to observe the inside of the body of the animal or the patient without open surgery. So it's predominantly a diagnostic protocol for detecting abnormalities or pathologies in the GI tract, but it can also detect pathologies in the respiratory tree or the superficial canals in the body, like the ear or the nose or the upper respiratory system, and so on and so forth. So one, it can do diagnosis. Two, it can also take biopsy. So for instance, it can obtain biopsies of neoplasia, ulcers, dystrophic situations, hyperplastic situations, and so on and so forth. In addition to that, it can also be used to do minor treatment, such as removal of what they call a polyp in the nasal cavity, or removal of earwax, or cauterization of a bleeding vessel, or removal of something like a non-malignant tumor. So it is made of an endoscope, that is the primary instrument. So it's just a long, thin, flexible tube with lens and light source and a tiny camera attached to the tip, so that the camera will allow transmission of the images to a monitor on the outside. And then the lens could allow you to manipulate the images. You can see them upside down or at different angulations if you want to. And then the light source will allow you to see where you are going. So the endoscopes are introduced via natural orifices. So you don't make an incision, you don't make provision for it. It just goes through the natural orifices on the body. Next slide. So this is the Ikeda endoscope at the Veterinary Hospital, University of Maiduguri. The picture on the left apparently is the image on the day it was installed. So you can see somebody behind it making some connections and other things like that. But on the right side, that is the Ikeda in action. You see the control system up there with a small LCD display, and then the endoscope per se is still closed in there, so it's attached to the, and now the terminal, you can use it for assessment. Next slide. So procedure is simple, but because the animals could resist the introduction, so you do what we call a numbing spray. So if you have a xylocaine spray or bupivacaine spray, you administer it to the throat or to the mouth, and then in delicate animals, you can also use mouth guards so that it can protect the oral cavity and the teeth. So it is passed through the mouth, down into the esophagus, the stomach, and the duodenum through the upper GI tract, or it can be passed through the anus to the rectum, to the large intestines through the anus. So sometimes it can allow the pumping of air into the space you are going to work on, so that you can spread out the tissues and more space for you to view what you are looking at, either in the stomach, the duodenum, the large intestine, or the small intestines. It can also be passed through the pharynx to the larynx and then into the trachea and the bronchia, so that you can see the respiratory tree. But it's just not limited to that. For example, this is an excellent ear endoscopy, the field of vision in a dog ear canal. The A is showing the ear canal with the arrow pointing to an earwax, but the texture of the canal or the lining is so distorted that it is interpreted as an infection. So this is an infected ear canal. In addition, there is an earwax down there. In the image labeled B, you can see the normal ear canal that is smooth and pleasant to see, but the only thing that is unusual there is the earwax. And so if you get to that type of diagnosis in A, you can institute check samples like swabs, and then do your antibiotic sensitive test or isolate the organism, and then you treat. But for earwax, you can either remove it with an ear hook or a gentle suction using a suction pump. Those ones can go. You can also use endoscopes to diagnose and remove polyps. So on the left side, labeled C, you have a dog ear with a nasal, the dog nasal cavity with a nasal polyp there. D is a normal image A. The B is an endoscopic image where you see more details, the pedicles, the connections, the freeness of the polyp, and then C after it had been removed. So you can use it to diagnose and you can use it to treat. Next slide. Yeah, so this is another endoscopic images. So these are normal trachea. The A is the normal trachea, as you can see it almost round. The B is what we call the tracheal collapse. So the trachea tends to flatten out, but it's just a grade 2 tracheal collapse. So all you can see in the dog that has this would be occasional cough that doesn't respond to any kind of medication and so on and so forth. Grade 3 and grade 4 are severe, but grade 1 and grade 2 the animal lives with them comfortably. Next slide, please. Again, and then see the tunnel going in and so on and so forth. In B, there is a severe gastritis in this dog. It's still the stomach, but this one is so corrugated and so rough, and you know that it's not smooth and something is wrong. So it's gastritis. C, severe gastritis. In addition to gastritis, there are blotches of blood or patches of bleeding. And so with endoscopes, you can identify those things. You go down to D, the normal canine esophagus with the sphincter, the one sphincter that goes into the stomach. Here, the same esophagus, but there is esophagitis, and even the sphincter does not close completely. So if an animal has this situation, it will easily throw up feed after eating and so on and so forth like that, because during the churning, the stomach contraction process, it will just eject part of the food or part of the feed upward because the sphincter had not closed enough. And F is a benign esophageal tumor. So that is the one like a bleb here that is brightly colored. Otherwise, the esophagus is really okay. So these are the things you can do with an endoscope. We take on laparoscopy briefly because sometimes people tend to mistake both as one and the same thing. Laparoscopy represents a landmark revolution in surgery, and it initiated the minimal invasive surgery we talk so much about today. The cardinal later, but the laparoscope with the laparoscopic instruments, irrigation system, insufflation system to effect pneumoperitoneum, navigation system that allows 2D imaging when it allows the upper component to go 180 degrees and the lower component to go 100 will allow you to obtain a 2D image. So what does it do? It allows the real-time visualization and examination of the abdominal and the pelvic area disorders. It records and then it stores. So, and then it will allow you to edit the images, and then you can take these images and send it to anywhere in the world to experts like you who will help you get a second opinion. It's minimally invasive. It means you can use it to do those things that we used to do with open surgery. Things like rheumatology, you can do laparoscopic rheumatology. You can do hysterectomy, you can do ovariectomy, and so on and so forth, all through minimal invasive process. So it can diagnose, it can treat, and it can also help obtain biopsy of organs in the abdominal cavity without opening the animal. Next slide. So like I said earlier, we're about to get this system. We don't have it yet, but we have a few people who are knowledgeable about its usage and utilization. So it will arrive soon, so it will only be relevant for us to have basic knowledge about its application and functioning. So this is how it looks like. Now, it has a monitor at top of it, right on either case. Then it has its gadgets. Some of them are controls, some of them are recording devices, some of them are storage devices, some of them are analytic devices. These portions in the middle are laparoscopic instruments. So they're different from the standard surgical instruments, but you can have laparoscopic scissors, laparoscopic sponge forceps, laparoscopic hemostat, laparoscopic hook, and so on and so forth. So you can just do surgery as if you are doing surgery with the standard surgical set. But this time around, you are doing it through a minimal invasive approach. Next slide. So, like I said, laparoscopy has vast advantages. Because of that, we opted to have it as one of the equipments that will help us improve our practice, either institutionally or in our personal expertise. So it's versatile, it means you can do so many things with it. It's very fast and it's safe for diverse applications. it alleviates tissue trauma. So you have minimal tissue trauma, you have very reduced pain, you have brief morbidity, you have quicker recovery, minimal hemorrhage, lower chances of infection and contamination, the minimal scars, so better cosmesis. But in addition to those kind of advantages, it has also been used when physical examination or imaging tests such as X-radiography, CT scanning, ultrasonography, and MRI scans do not provide enough information or insight to confirm a diagnosis. So if you have an equipment that can give you information as good as this imaging said, I think if you have one of that and then others on one side, I will still pick laparoscopy system. So it's as good as that. And then it allows direct visualization to clarify hidden pathology, of course. That's what it does, because if imaging doesn't do it, it can do it. It has been shown by other workers to be more accurate than radiography in staging cancers of the digestive system. Next slide. Yeah, so this image, the animal, that dark colored animal there is called the nutrients. So a lot of surgeons practice to improve or to acquire skills. And this is it's a sketch, but it's a sketch of this animal. So the procedure here is to allow you to see the abdominal contents, but you don't go through the orifices. Here, you go through 2 to 5 stab incisions. So you make stab incisions. One is for the laparoscope, and then the others are for the laparoscopic instrument. So if you want the hook to go in, you go through one of the stab incisions. If you are through that, you can take it out, then you send in the scissors. You can take that out and send in the hemostat, send it out and send in the forceps, and so on and so forth. And so the laparoscope will be there permanently because it will be illuminating the place, it will be streaming the image through an LCD display component of the machine. And so those are how it operates. And for clarity, sometimes we do what we call pneumoperitoneum. So you can push in some gas so that it can just allow the spreading out of tissues and organs within the abdominal cavity so that you can see better. Next slide. So this is a real deal, or this is how laparoscopy in action is. This guy's on the left. You see them, although they are going into this animal lying down there, but the image is captured on the on that screen, and so you can just wiggle and go around and so on and so forth. But the sketch up here tries to show the laparoscope there and then the other lab instruments there. So this is the beauty of laparoscopy. You don't open the animal, but you're doing surgery as if you are inside. So I will stop at this point, and Dr. Aliu Haruna will see us through the DEXA equipment. Thank you.
So thank you so much, Chef, for sharing this wonderful, interesting topic with us. I must confess, you have done justice to this particular topic. It's really amazed me to see how more digitalized this world is becoming. This topic, particularly utilization of high-tech equipment, it's going to help our professionals have huge experience in the healthcare field, leveraging their expertise to use the high-tech diagnostic equipment. So once again, thank you, sir. So next on the agenda is our second hub expert in person of Dr. Aliu Haruna, also from the Department of Veterinary Surgery and Reproduction, University of Maiduguri. Dr. Aliu Haruna has obtained his own Doctor of Veterinary Medicine in 2005, and MVSC in 2019 in Veterinary Surgery, Orthopedics, and Large Animal from the University of Maiduguri, where he also joined Professor Paul Boko on TED Fund grant, where they work on dual energy X-ray absorptiometry, which we are just talking about now, phasing of fracture repair, following internal fixation, and zoledronate treatment in sheep orthopedics, which is the fracture model. And he's currently undergoing his PhD, supervised by Professor Paul Boko in diagnostic imaging. Dr. Aliu Haruna worked with China Geoconstruction Overseas Company in 2007 to 2008, also Global Vet Care Consult in Ibadan, Oyo State, and also worked with Ralba Agrovet Consult in Jos, and is currently a senior academic lecturer in Department of Veterinary Surgery and Radiology, University of Maiduguri. And he is the Dean Representative on the Department Academic Board with over 200 publications. So please permit me to welcome Dr. Aliu Haruna. You're highly welcome, sir.
Thank you very much. Thank you very much for having me. I'm going to speak on dual energy X-ray absorptiometry machine, which is the DEXA or DEXA, DPX dual or bone densitometry. The principle behind this DXA machine is all about being a low radiation X-ray emitter. What the X-ray machine does is it sends two different, it means it has two different tube heads, unlike the conventional X-ray machines that have one tube head. Aside the computed tomography that has 3 or more, this guy has 2, one of high intensity, while the other is of low intensity. The one of high intensity gives more penetrative power than the tube head that has the low intensity. Now, what do you want? What we know generally about X-ray machines, what we know generally about X-ray machines is that what happens to photons when they are expanded from the tube head onto the tissue is either they get absorbed by the density of the tissue concerned, or they penetrate completely to the detectors of the X-ray on our conventional X-ray films. The last is they get scattered. That is, they have no penetrative power. They hit onto the density of the animal, that the body surface, and they scatter. And those ones are the most dangerous within the X-ray workroom. Now, what happens in this DXA is that all we know, most modalities that we work with in radioactive or radiography is all about the attenuation of photons by hydrogen or calcium. What happens is in the softer tissues, hydrogen is active there, attenuating the photons, while calcium works from the bones. And that is the more reason why you have the differences in shades of gray from the bony tissues because of the calcium towards the skin out there. Now, a measure from this dual X-ray tube heads for the attenuation between the soft tissue and that of the higher bones is termed as the RST, which correlates with as an inverse of the proportion of the soft tissue, just like fats and others, musculature. Next slide, please. So what happens is just like photograph, X-ray beams scans the image. They scan the subjects pixel by pixel on the basis of the body. Pixels are mostly on cameras, those Zeiss and what have you. So those pixels are components that pick up these images as tiny as they could and display them on the monitor. Now, the DEXA results highly correlated with other criteria of other systems. Now, one peak that is absorbed mainly, that's the lower, is absorbed by the soft tissue, while the higher beam is absorbed by the bones. Now, the basic difference between the two X-ray tube heads after subtraction is what we have as the bone mineral density. So let's go to the next slide, please. Now, the density profiles, that is the basis of the work or the preference of the X-ray machine. The X-ray machine, the DEXA, can profile the bone mineral density of that subject in contention. Now, the density is calculated from a subtraction from the two intensity different tube heads. Now, the lower density you have as a patient, the greater the risk of fracture. What it means is that the moment you have a low density, it means you have problems with your bones. The density, the makeup, the build-up, orthopedically, the hydroxylated matrix that you have on the bone there does not really have the concentration of the matrix with calcium, phosphorus, and vitamin D, and what have you. It means it is depleted. Now, running the DEXA machine is non-invasive, and it runs basically from 5 to 10 minutes. So you are measuring your bone mineral density in 5 to 10 minutes. Then there's low radiation to workers and the patient as well. Because what happens in the machine is that the collimation has a pinhole for a pencil beam or a slit for a fan beam. It means it is not an exposure that once you expose the X-rays, a lot of X-rays with weaker or stronger intensities will drop onto the animal and some scatter onto the tissue and the radiologist, or get scattered within the workroom. Now, the radiation received by a DEXA scan is less than, according to Radiology Info in 2012 and 15, that the radiation that will be absorbed or attained by a passenger flying from California to New York and back to California is higher than a DEXA scan. So it means that the radiation exposure is minimal in DEXA machines. So DEXA machine is an imaging test that measures bone density or bone strength. Next slide, please. So DEXA scans have the power to diagnose osteoporosis. Just like I said, the bone mineral density could be calculated. Now, once there's no bone mineral density, it means it's either you are running into osteopenia or you are running into osteoporosis. The bone loss completely. So it can diagnose and as well as monitor the treatment of osteoporosis. Likewise, it can predict and diagnose fractures and monitor treatments of fractures. It can monitor therapeutic progressions. Just like I said, as I proceed, we see the monitoring of the therapeutic progression in different therapeutic regimens. Now, this test can also measure body composition, such as the body fat and musculature, as well as evaluating carcass quality during meat inspections. These machines have been used in China for measuring carcass qualities. People don't just walk into the abattoirs to buy meat. They have to measure the quality of the meat using DEXA machines before purchase. So it measures the volume and mass using the latest core scan DEXA software from General Electric in America Healthcare. So the ease that DEXA affords is in older patients and as well as patients that are afraid of hydrodensitometry. Next slide, please. So generally, it is accepted internationally that the DEXA machine is a gold standard for measurement of bone mineral density, that is bone densitometry. There are other technologies like the quantitative ultrasonography, quantitative computed tomography, MRI, and single photon axiometry, the dual energy photon axiometry, and radiographic axiometry. The DEXA or the dual X-ray energy axiometry happens to be the gold standard. It is accepted internationally for measuring bone mineral density over all these other modalities. Now, it represents the most accurate and cost-effective parameter to use in osteoporosis or risk of bone fractures index. The stuff is all about T and Z score statistically. Now, in normal patients, whenever you have a -1 on the graph of X and Y axis to greater or equal to 1.0 density, you are termed as normal. Now, once it is a -1 to -2.5, that person is referred to as osteopenic. It means there's low bone mass. Now, those who have a equal to or a greater value, greater than 2.5, -2.5, the standard deviation based on that ENCORE software statistical calculation employed in the machine, it means that patient is really running osteoporosis or at the risk of having osteoporosis. Next slide, please. Yeah, so this is a dissected DEXA machine. What we have underneath are two different energy photons. As you can see, the patient is lying on a bed while there's a detector above the patient. These detectors, while engaging the work of the DEXA machine, scans through the specific body part that is being questioned. Now, these X-ray sources will come out as pencils or fan beams, which means scatter radiations are negative there. So eventually, what you are getting from the detector is showcased on the monitor from the hardware aside from the machine that will be detected. This plate is from the International Society. The next slide. Now, these are from the bone mineral densitometry machine compared to other machines. As you can see from the average effective dose and the range reported in literature, those lowest compared to the other radiation doses that will be exposed to radiologist and the patient. Next slide. Next slide, please. So this is the DEXA there for the patient to lie on, and there's a scanner or detector above. So it means the X-ray tube heads are below the patient. So these photons will now be emitted from below, and this from head to toe of the patient. And on the right, you can see used together. So you will sit by the monitor, you have your CPU, your UPS, and whatever. So eventually, the DEXA machine is a real-time machine, because from here we can connect to our internet geographic X-ray pictures with our other radiologists from all over the world for a collective diagnosis. Next slide, please. So as we can see, we have this canu pigeon that was scanned. It came to the veterinary teaching hospital. On the figure 2, on figure 1 is the bird with the tumor. Then on figure 2, it is showing the lateral view of the DEXA scan. As you can see, just like I said earlier on, that it depends, X-rays happens to work on hydrogens or calcium attenuation. So you can see areas that are radio opaque, showing clinically possibly issues underneath the swollen part of the animal. Now on figure 3, the surgical procedures for the removal of the tumor is a hemangioma actually. Next slide. Now, what happens here is an osteotomy on the radius and ulna of sheep orthopedic models. So in A, you see where it has been aseptically prepared. We shoved and aseptically prepared, draped, and ready for B, which is the skin incision, and onto the bone itself to be exposed. So that's the radial bone in C exposed with bone exposures. So we use the M14 drill to as an osteotome to separate the bones or to have a fracture discontinuity in the bone architecture. Then that is in E, showing a sample of it. Then we drilled using the M14 drill that has different drill bits and drill guides to drill into the bones for application of bone plates and bone screws at the same time. Next slide, please. Now, as you can see, we've positioned 2 screws already with the bone plate, and we've had an osteotomy, a separation of the of the bone into 2. Now you can see the application using the screwdriver, applying the screws onto the bone plate, and you can see in C, the screws are tightened. Now in D, we are suturing using polyglycolic acid size 2.0 of the musculature within, and you can see horizontal mattress in F to close the skin. Let's go to the next slide, please. Now you can see our subjects now anesthetized or sedated, placed on the DEXA machine. So with the detector or the scanner, so we are scanning the right radial bone, as you can see in the 2 different samples. Next slide, please. That you have on the DEXA scan. So you can see with radiolucency as well as radio opacity, and clearly you can see the opacity of the bone plates and bone screws, while in the where there's the fracture line, as well as where the arrow is pointing is. So we took from days 21, 27, and day 35. And as you can see, the progression of the from the middle of the 2 screws in the middle. So you could see the protrusion or the callus formation from the 20. Next slide, please. Now, this is day 42, 49, and day 56. classically, the callus has enlarged, and the fracture lines are now no more visible. As you can see, the density and the radial opacity of the plates, as well as the callus and sides of the bones. Next slide. Yes, so I mean 63, 70, and 77. You are seeing the same thing as I said, the callus time or from weekly like we had. So the next slide, please. Yes, so you can see from day 84 and day 91. So what happened was we created the then applied bisphosphonates, which are zolone and zometa, which are zoledronate or zoledronic acids. So we monitored the callus formation, the enhancement of the callus formation, because basically what bisphosphonates do is to enhance osteoblastic activities. That means there will be osteoclastic activities. Osteoblasts and chondroblasts will now have more opportunity to work, to lay down more callus than the osteoclastic or chondroclastic activities. What it entails actually is that bisphosphonates have the ability to cause these osteoclastic bones to undergo apoptosis. So that thus we did, and we scanned through the 3 to the 91 of the instances that we created using the differences, the different treatment, dual X-ray absorptiometry machine. And we have the T and Z scores, likewise the bone mineral densities. All these animals here were having values above the normal. So we never had any animal that has. So what it entails is mostly when you use the DEXA machine, it is mostly in women menopausal. What I mean here is people, women that have gone on to the age of not bearing child anymore. So what happens is estrogenic activities will deplete completely. There won't be any menstrual period where menstrual cycles within the months. So there won't be depositions of that is bone deposits now, calcium deposits within the intramedullary of the bones. Now, what happens is while women from age of childbearing to that 45 must have had children or kids, it means they must have been having issues with bone resorption. It means osteoclastic activities must have been working on each wife or each animal that has been bearing child, because the fetuses do not have any barrier to build themselves. They just take up osteoclastic activities to the dam or the mother and return calcium, phosphorus, and vitamin D to themselves to build up their own bones after the first trimester, where they have a series of musculoskeletal growth or development. So most at times, women or animals that are of old age that must have attained postmenopause, it means they are at risk mostly of osteoporosis. So they are the candidates for this DEXA machine, the good candidates for the DEXA machine. So they could be scanned and they could stand either at osteopenia, they could be normal or have issues with osteoporosis. I was sometime discussing with some two ladies, and one of them was already pregnant, and she was telling me the last time she was pregnant, she had a fracture on the femur. So I eventually told her Was there anything on her? No, that she was just walking and she fell. And before it was the pain that brought her down. So there was a fracture. So it means there was already the osteoporosis, which was not scanned and detected while she was bearing the second child and eventually ran into osteoporosis. Next slide, please. So in conclusion, timely and accurate diagnosis can be better attained with the use of high-tech diagnostic tools like we have seen here with us at the VTH in University of Maiduguri. So once you have an accurate diagnosis, treatments will be easy because it is accurate. You know where to hit and get your results from the treatment. Then the regulatory bodies, our practitioners and our curriculum developers, our opinion leaders, our schools should please assist us in giving us more advice. I think working with the DEXA machine has proven so much something that, and I must confess that I thank God and I thank Professor Boko for giving me the opportunity and the privilege to work with him through to see what high tech means when it comes to the diagnosis. Thank you very much. Next slide, please. Thank you.
Okay, so thank you so much, sir, for shedding more light on the dual energy X-ray absorptiometry. It's really an amazing one and very impactful. And then the fact that dual energy X-ray absorptiometry can also be used in the abattoirs. So maybe we can use it in the abattoirs to evaluate carcass quality for meat inspection. So thank you once again, sir. So next on the agenda is the question and answer session, the participatory session, which is supposed to be anchored by the CEO, Farmalert, in person of Dr. Femi Kayode. But before then, before he comes online, I'll be reading all the questions. So our HOP expert will help us answer them. And please, if you have any recommendation, you can use the raise hand button. I'm going to unmute you for that. And if there is any need for you to speak or say something, you can also do that. So thank you once again. I'll be reading all the questions. Okay. I'll be sharing it. Okay. There is a question from Ayodele Eke. He said, can infrared thermometer measure core body temperature? I don't know, sir. Is Professor Paul Walker also on the...
Yes, I'm around.
Okay.
Yeah, so I think I was...
This is an open discussion.
Okay,
fine.
Okay. Yes. So the infrared usually measures the heat in the surface tissue, like the skin. It doesn't go deep into the core like clinical thermometer does, but if the interior is hot, then the outside will be hot as well. So it's indicative rather than confirmatory. But we are talking about situations where we have moved from analog to digital and real-time kind of protocols from mercury thermometer to digital, for instance, and infrared. Okay, that's the short version of the answer.
Okay, so thank you, sir. He also asked a question, Omotayo. For us in active practice, this is more theoretical than hands-on. Can we have a wet lab session?
Yeah, that's fine. Okay, go ahead.
Okay, thank you, sir.
Sir, please, can you unmute?
I'm not mute here. I can see it's showing
Okay,
green.
yeah, you can. We're hearing you now.
We had a wet lab, just like I showed the scans that were done and photographs there from the DEXA machine. It was we performed osteotomy and we got the results from arrangements. So what I'm saying is the 1,000 or 150,000 states. The US is trying to go towards DEXA machine. They are seeing or the capabilities from the DEXA machine. I think that was why I said from the last slide that our policy makers should help us. I am sorry to say that the DEXA machine that came, the one that we worked with, happens to be the first in Nigeria. I can stand and beat my chest anywhere. Likewise, I can tell you if it is the first in Nigeria as the giant of Africa, it is also the first in West Africa and the first in Africa. So you can imagine where in the US we have 150,000 pieces and we are managing one here. So if you have a place where you are managing your clinic, you can as well make a referral. We could have referrals here. Like I've seen people being flown with samples to the US or UK for sampling and they return back with the results here. I think even humans do this paternity test of a thing that is raining now, take samples and go overseas and come back with the results. So you can fly from anywhere in Nigeria to Maiduguri, we scan and you go back. The basic thing is let it be on the client.
So thank you, sir. Okay, I think another question directed to Paul Boko. Sir, what is the most preferable ear exams? Is it otoscope or endoscope?
Yeah, if you talk about otoscopes, ophthalmoscopes, arthroscopes, endoscopes, laparoscopes, the principle is the same. They can be redesigned or they can be engineered towards the use for a particular part of the body. So if you say it's an otoscope, it's mostly for ear examination and observation. So otoscopes, along with curettes and other components, can be used to clear the ear. You can take swabs and other things. But for versatility, if you want to use one equipment for the upper respiratory system, the ear, the upper GI tract, and maybe the respiratory tree, I think endoscopy system will be more preferred because otoscope will be restrictive only for the ear. So the principle is basically the same. So depending on the grade of the equipment, if you put them side by side, none is better than the other. The only thing is otoscopes for ears, endoscopes, ears, and other parts of the body. Thank you.
All right, thank you, sir. There is another question. Please, if there is need for you to talk, you should use the raise hand button.
Okay.
I'm going to unmute you. Okay, so another question. Has the central monitoring device parameters been compared to the more established physiological parameters in animals at Maiduguri to be sure of its reliability?
Okay. I think this is coming from a situation where we do not doubt the patient monitors. They measure parameters and tell you what they are at that time. For the parameters that have been established, it means you do a study of hematology and you say the PCV in this particular species of animal is this. And yeah, so I can't remember where parameters like the SpO2, PaCO2, the ETCO2 and the ICGs have been recorded anywhere in Nigeria in the veterinary practice or even in the human practice. So they are not standard for those ones. For the heart rates, the monitor will just give you the heart rate at that time, the temperature at that time. So that's why we call it in real time. So as much as we work within the established ranges, we are not trying to create a new normal kind of parameters. We work with the established parameters, and if the monitor says it deviates from what is established, then we think that there may be a pathophysiology or a physiopathology depending on the pattern. And so I think so there is no contradiction whatsoever between what is established and what the monitor can do. They are all synergistic in a sense. So that is it. So it's not, we are not going to say because we are using a monitor now, because it's a high-tech digital tool, then you have to do a study again to re-establish the established parameters. So we just go from there and continue. Thank you.
I think I would love to add to this question. There was once we were working on these parameters, and it happened that one of our colleagues that was here we before the patient came in, we applied those apparatus on him to see if we could monitor or measure the body parameters. And eventually one of the professors saw and said, wow, you are at the risk of having a high blood pressure. So I think the same kind of question, this person felt, no, this could just be a new thing or it's not part of the normal stuff. Let me tell you, this guy had a stroke before 3 p.m. So I think it shows definitely that these things are working together. They are accurate. Well, after all, they are coming from the same countries, except maybe we build ours that is in Nigeria to be different from theirs. They are coming from the same altitude. So I think they are working hands in hand.
Okay, so thank you, sir. Another question from Alex Etim. For patient with MMVD, can the patient monitor height in detecting heart murmurs?
Okay. Like if you have valvular defects, like the heart murmur is a kind of a valve issue rather than electrical activity or even mechanical activity. So if you think that is the situation, well, the number one option, if you suspect a heart murmur, is to do echocardiography, a form of ultrasound that measures the functions of the valves and then the atrioventricular function and so on and so forth. So those are the things that can be done. So if it's your first option, the monitor only tells you about irregularities that it finds. For instance, if there's fever, it will just tell you the temperature. So then you, as a clinician, will say, okay, there's fever because the temperature is high. If there's a situation where you find out that the PaCO2, for instance, or the SpO2, not the SpO2, the ETCO2 and the PaCO2 are moving away from the ranges, then probably the murmur could be responsible for not effectively channeling the blood to where it is. Also, there's a mixture of oxygenated and deoxygenated blood, so the carbon dioxide level will increase, the oxygen level will decrease, and so on and so forth. But for heart murmur as a condition, echocardiography is the best option.
All right, thank you, sir. Someone is still asking, can DEXA be used in pet dogs with panositis?
With what? I beg your pardon? Panositis?
Panositis?
Yes.
Okay. Actually, DEXAs could scan both, just like I said, one has a high intensity and the other with a low intensity. In cases with osteitis media or interna, I think generally it can detect changes in the soft tissue. Just like I told you that it is all about hydrogen and calcium within the embedded tissues. So it can detect issues within the ear, if it is deep in, or things with the bones within the ears, or the eustachian tube there. So I think it can detect, because even if it will not show you exactly what you have there, it could measure to tell you that there are irregularities with the soft tissues there or the bony tissues in the specimen in question.
Yes, exactly. I think the DEXA, for each activity, it does three things. It will tell you the bone mineral concentration, it will tell you the bone mineral density, and then it will give you the images of both the soft tissue and the hard tissue, which is the bone and the soft tissue surrounding the area. So you're going to get three sets of information, and it can easily tell you from the information you get, then you know bone density or a decreased one, whether the tissue, for instance, can undergo some form of reaction or ossification, or by which the equipment was designed. So it can tell you a lot of things, including the panosteitis.
Okay, sir. So someone said that just to point out that nutrition can be a huge factor in bone density impact also. It may be worthwhile to assess the impact of using DEXA.
Yeah, just like I said earlier, you see, what happens is once there are, calcium, phosphorus, and there's really going to be issue with the bone mineral density. C and BMD are the measurements of the DEXA. You have a quality bone, or you are a non-qualitative bone. So nutrition matters, and I think that is the issue. If someone is at the risk of fractures, now you begin to become a policeman to investigate. You know, definitely that person must have, and likewise run into the calcium and what have you that builds up the bone. Where there's no postmenopausal, and you have this person has no to him. It takes us, and just like the T and Z score, while the Z scores measures in younger children, so it can still determine the strength with nutrition, the nutrition, milk, and more of calcium because of bone, the mineral. I don't want to mention some of our MEAs, yeah, you know.
Okay, so thank you, sir.
Okay.
The problem is, are these two available in Nigeria, especially the portable one? Someone is asking.
Okay, that's fine.
Well,
I think at the VTH, In the University of Maiduguri and the Faculty of Veterinary Endoscopy system, we have the BM5 type of bedside monitor. Then we're going to get the laparoscopy system. I am sure the patient monitors are common in various types. The one that will suit us are always on the go is a portable one. It's just the size of the. So it has 2 or 3 terminals. You can just put in your bag and you can use it anywhere, anytime. Very available. Well, one thing with equipment is if you cannot make it, they are making it. So we don't make DEXA in Nigeria, so we had to buy. We don't make this monitor, so very affordable. For instance, a monitor, $50 to $100. The bedside one ranges from $147 to maybe up to $500. Expensive one because it's more recent and this has a lot of parameters. So these equipments are very affordable. But we were only able to buy it with the help of the TED Fund grant, which we are very thankful to TED Fund for that. I think that's what I would say. They are very accessible. You can just buy a equipment we have at the VTH were delivered to us at the VTH after. Have to go to do anything, and the good thing about it, which is different from the public times, they deliver things to you and you get surprised that you wonder where that is. Especially the patient monitors. So instead of going about with a status, you get one patient monitor. You measure the temperature, measure the pulse, respiration, the NI measures 5 to 7 basic kind of parameters. I think I will go for that if I get it for the change of the naira, because the naira is fluctuating against the dollar every day. But at the time we procure naira to a dollar, so $100 will be 19,000 or around about that.
All right, thank you, sir. Dr. Kayode, I can see your hair with us. So, sir, over to you now.
Well, I saw you were enjoying the conversation, probably because you are from the same alma mater, but again, well done, good job.
Yes.
You've gone through most of the questions, and I think that's about the bulk of the interaction. What I would just want to suggest is, I see Dr. Kunle Abiade also on the call. Dr. Kunle sir, you understand these things better than we do, and you're also on the field. I want you, if you don't mind, add your voice to this conversation. Let's hear what you think. I know it's an impromptu call, but we're asking you to unmute. Dr. Kunle has one of the most extensive veterinary hospitals that we have in Lagos. I've been to his place quite a couple of times, and I've seen the level of equipment he has. And I would just want him to quickly, he's also the president of SAVAN, Small Animal Association, Veterinary Association of Nigeria. We would just want him to add his voice to this before I probably also make my own observations. All right, fantastic. Good morning, sir. Good afternoon, rather. I'm in Nigeria. I should not act like I'm somewhere else. Yes, sir. Okay, you're muted. Let me ask you to unmute.
Hello. I'm driving, so I'm driving. I'm taking my wife out. I've just been listening to what's been going on in Maiduguri. I'm so thrilled that we have such equipment, as well as the DEXA machine. I mean, I know that it's been used in human to measure the the bone density, but I didn't know that it's now available with for use in animals. So I'm highly thrilled, and I'm very, very happy about it. The lecture has been very, 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 very professional, very technical, and at least it's very illuminating to many of us who are doing surgeries without good monitors, and to know some of these advantages of these equipments. Really, this lecture has shown that we need to really upscale our delivery of service. I mean, it should be a taboo for a vet to do a surgery without proper monitoring, and which most of us are doing, putting the risk of our patients at risk. And I think this lecture has really brought to the fore the importance of all this equipment, and that they are available. I mean, otoscopy, endoscopy, they are even available in Nigeria. We use it in our practice, and it is something that everybody, if we are really, really determined to practice, should obtain. If you don't, I don't think maybe some level of practice, you should not involve yourself in it. I mean, that's all the truth. So I'm highly impressed. I thank the organizers for bringing these high caliber professionals who have come to really, really expose a lot of us. I'm thrilled about the DEXA machine, and I think I would take a trip to Maiduguri to see the operations. I really want to have it. I would love to see it. I've seen it in Lut. I mean, I've seen the operations in Lut, but to be used in animals, I would love to come and try my hands with it. Thank you very much, everyone. Thank you, and Dr. Ali. Thank you very much.
Thank you so much. Famala will be willing to support that kind of collaboration, your visit to Maiduguri. I'm happy to hear this. I was talking to, just if you want to make a comment, I think we can still just take one more comment before I hand over to Dr. Zainab, our moderator for today. You know, because of my schedules, I usually like to take night flights. And one of those days, I came back and I was telling my team that we flew into the sky, and we landed at the exact time they said we were going to land. And we're in the sky. There's something called precision medicine. The abracadabra we have done in the veterinary profession is too much, right? We just jab and jab without using high-tech equipment. If the plane don't fly with English, they fly with precision. Right, they fly with coordinates. And the sooner we start embracing that precision medicine by using this equipment, I think the better for us. I'm really very happy. And then we thank the University of Maiduguri for this collaboration to see that this equipment, if Dr. Kunle Biade could say he is thrilled, then you know that the entire veterinary profession is really something on his feet. And I'm happy to hear that. Thank you so much, the hub experts, for this word. I think nobody is raising his hand, so I will just pass the baton back to Dr. Zainab. To do the post quiz, I think you really don't have any option but to have 5/5. But if it's still very tough for you, we will be making the recordings of this video available for you. Don't forget, it's a professor that sets the pre-quiz and the post-quiz. So happy to have you also miss some. We will understand. Thank you, Dr. Zainab, Over to you.
Okay, thank you, Dr. Femi. It's good to have you here. And once again, thank you, Dr. Kule, for sharing this with us too. So now next on the agenda is the first quiz. So it has 5 minutes. It's all the same question. So with this presentation, I know you can be able to go through it and answer it very well. So I'm taking you up to the first quiz. Okay. So I don't know if there is need for me to read it through again for you. Okay, number 1 says, which of the following statements in relation to dual energy X-ray absorptiometry, the DEXA scan is correct? You can see the options. Just go through it.
How are you?
And please, Zainab, if you'd like me to come in, please let's all participate. At the end of the day, we submit the percentage knowledge gain, so that we also submit to the people who are supporting us that, oh, we held this class, and then this was people scored 0/5 at the pre-quiz, and now they are scoring 5/5. Even if you don't have 5/5, 4/5, 3/5. The only thing that will not be nice is when you score 0/5 at the beginning and 0/5 at the end. Then we will not be really very pleased. But you can make the attempt, and let's have you participate in the post quiz.
Okay. It's still going. Like, please, let's participate. Let's all participate. We're just having 3 minutes more. People are not participating. Please, let's engage. Please, can we participate? I know with this presentation that just finished now, it's going to be a very simple one for all of us. So please, let's keep participating. Please, let's engage. At the end of this first quiz, I'm going to give out the percentage, and all of you are going to see the answers to these questions. So please, let's participate. Let's test our brain. If really we understood what was going on. So please. 2 more minutes to go. Let's keep engaging. Please let us all participate. Two more minutes to go. I know it's not a difficult one. Please, let's engage, let's engage. Okay. 1 minute, 30 seconds to go. It's just 5 questions. Please, let's engage. Okay. One more minute to go. The time is almost over. Please, let's. Okay. Few seconds to go. I just hope you all will get those answers correctly so you can tell your errors in the past pre-quiz session. So 30 more seconds to go. Let's go, let's go. Let's do it. We can do it, I know. Please, let's go. Okay, okay. 10 more seconds to go. We just have less than 6 seconds to go. Okay. Time. For those that have answered, I just shared the results.
So
Maybe you
Dr.
can
Zainab,
just see.
I
Yes.
think it's appropriate you ask our resource person to answer the question. So you just read out the questions and then our resource person will provide the appropriate answers.
Okay, sir. Okay, Professor Paul Boko and Dr. Aliyo Haruna. Are you with us, please?
Yes, we are here.
Yes, sir. Okay, let me just read out the questions. And then you kindly answer the questions for us. So, okay, number 1 says, which of the following statements in relation to dual energy X-ray absorptiometry, DEXA scans is correct? A lot of people got 17/17. 100% answered. Okay, it set an initial DEXA T-score of below -2.5 is considered low risk and no further scanning is required in patient receiving ADT for prostate cancer. B, an initial DEXA T-score between -1 and -2.5 is classified as intermediate risk in patient receiving ADT for prostate cancer and requires further DEXA scan every year. Okay, C, risks of sustaining a bone fracture after 5 years of androgen deprivation therapy is 50%. Okay, okay, well. Okay, Okay, so I don't know, sir, are you with us?
Yeah, I'm here.
Okay,
Okay, so
the last option is DEXA scan, a whole body scan, and are safe in pregnancy. And the other option is a DEXA scan requires approximately 90 minutes scan time. So what's the answer?
yeah, so I don't know, there are a few things encompassed in. So a score between -1 and -2.5. That's
Yes.
osteopenia. If it is greater than, well, 5 is higher than -2.6. So it's less than 2.5. It would downward. That will be considered osteoporosis. But it can be used for a whole. It takes just 5 minutes, 5 to 10 at the most. So, I don't know which choice is.
Okay. So the answer is showing it's B.
Okay.
An initial DEXA T-score between -1 and -2.5 is classified as intermediate risk in patients receiving ADT for prostate cancers and requires further DEXA scan every year.
Yeah, that makes sense. That's osteopenia.
Yeah. So number 2 says that which of the following statement is true? Is a single choice actually. So A says iodinated intravenous ionic contrast agents are safer than the non-ionic types. B, gadolinium-based contrast is safe in the severe renal failure. Then C, metformin must be stopped prior to the use of any iodinated intravenous contrast. Then D says nephrogenic systemic fibrosis is a recognized side effect following use of gadolinium-based contrast agents. And the last option says anaphylaxis as a contrast agent is treated with 5 milligram intravenous, 1:1000 adrenaline. So the answer is showing D. Don't know, maybe you can shed more light on that, sir.
Yeah, so if you're talking about gadolinium, it means we are drifting towards MRI, actually. It's a scan using X-ray, so it's more of X-ray technology. Gadolinium is a contrast media for enhancing MRI signals. So yeah, metformin is a treatment for diabetes. So it is thought that if you are going to use iodinated intravenous agents, suspended at least for the period of the prior to that, and agent, I'm thinking intravenous iodine just requires is indicated that things like promethazine, those effects. So the gadolinium would be more appropriate, and different situations, except that if the treatment is going on.
All right, thank you, sir. Number 3 says, what is another name for dual energy X-ray absorptiometry? Only 21% got this right. A says BMD scan. B says bone densitometry. C, bone mineral density scan. D, DEXA or DEXA scan. And E, all of the above.
Okay. Yeah,
So,
potentially there are many answers that are correct. Yeah, so for instance, BMD scan and bone mineral density scan is one and the same thing. One is abbreviated and the other is just
yes.
yeah, full listing. Yeah, so bone densitometry is correct. DEXA scan is also correct. So normally a BMD scan, but it's called DEXA scan or bone density or bone scan. So most of them would
So
be
the
correct.
answer is all of the above.
All of the above would be the correct thing.
And 21% got it. Only 21%.
Okay.
Some
Okay,
were
that's
going
good.
for DEXA or DEXA scan. Like 50%
It's
of.
correct, but a lot of them are correct too.
Yeah, so all of the above is the answer. Okay, so number 4, it says a dual energy X-ray absorptiometry measures A, fat, B, muscle composition in specific parts of the body, such as the arms, legs, and pelvis. C, blood. D, A and B. Then E, C and E. So I think 50% went for B, but it wasn't the correct answer. The correct answer is B. So maybe you can shed more light on that.
Yeah, so
only 29% that got it
yes,
right.
so the DEXA scan has two intensity and the other is low intensity. So it can measure muscles, fats, and the bone. So it will probably be more correct. If it is just specifically blood, it doesn't measure blood per se, but it can measure, or it can image soft tissues, it can also image skeletal tissues. So if there are no muscles, if fat and muscles are there, then fat and muscles are correct.
All right, thank you. The last question, what are the two major types of energy used in X-ray technology? A, electrical and electromagnetism. B, ultraviolet and gamma ray. C, visible light and infrared waves. D, microwaves and ultraviolet light. And then E, mechanical and electromagnetism. So 21% got it right.
Okay.
The answer is actually A. So what's that?
Yes.
Can you say something about it?
Yes, it is. It's electrical and electromagnetism, because in your first class of radiography, they will tell you this electromagnetic spectrum where you have from TV waves down to gamma rays or X-rays, depending on the extent to which you want to study. So electrical and electromagnetism are more correct, because the electromagnetic spectrum, so is the visible light, so is the infrared waves. And so I think electrical and magnetism is correct. I don't know, is Aliu around? But I should have just shed more light on one or two of those things. So,
Okay, Dr. Aliu.
it's all right. Maybe there's a
I
feature.
think maybe
I saw him like flipper. Also, I think there are 5 questions about some them all. So those are the texts.
yes.
The questions.
Okay. Okay, so thank you so much, sir, for sparing your time out of your tight schedule to be with us today, especially our hub experts. You people have done a great job and you have done justice to this particular topic. So I must commend you for your efforts. Thank you so much, and thank you all our participants for engaging and participating in today's tech class session. Pharmalab now serve as a private continuing education providers to Veterinary Council of Nigeria. Our tech class sessions are free, but a token of 3,715 naira is needed to have your VCN accredited certificate and name submitted for your continuing education points. Steps to do that: make payment into the Pharmalab ECHO 79010492235 Providence Bank using your VCN numbers in the description, and send a message to Dr. Nancy Ini Otu on 09135000435 for verification. If you have any topic you want us to address, you can kindly comment, and you should not forget to follow us on all our social media handles. So thank you all for coming. See you on our next tech class session. Bye.
Bye-bye. Thank you, Dana.
All right.
Thank you very much. Thank you very much.
And goodbye.
Thank you so much.
Goodbye.